Hi, I'm Lucy and I'm here in the Minerva Building atrium to talk to you about the importance of sexual health. An STI is a sexually transmitted infection. These can be passed between people during intercourse through anal, oral or vaginal sex. It's important to talk about STIs because not all of them are curable. They're relatively common among university students and they are treatable as long as you know the signs. You can reduce your risk of contracting STIs by regularly testing between partners and using things like barrier methods, so common things that you've heard of like condoms, but other things like dental dams and internal condoms too. External condoms are one of the most commonly used methods of protecting yourself from pregnancy and from sexually transmitted infections. All external condoms have an expiry date, so check that yours is in date before you use it. If it's not, it might not be safe to use. Also check for things like damage to the packaging and make sure that you don't use anything sharp to open your condom because that could put a hole in it and then you're not protected against STIs and unwanted pregnancy. Even if your condom's expiry date hasn't passed, if you've had it in a wallet or in a bag for more than a month, it's not safe to use. Throw it away and get another one. Internal condoms are another barrier method that are effective against unwanted pregnancy and STIs. Internal condoms are a little bit more difficult to find than external condoms, but Brook have a great tool that help you locate where you can get internal condoms near you. Internal condoms are inserted into the vagina or anus and they have two flexible rings, one which goes inside and one which you need to make sure stays outside the body. To prevent unwanted pregnancy or STIs, when you remove an internal condom, you should twist the outer ring to make sure that any semen is collected inside. Dental dams are usually made of latex and they're a thin sheet that can be used as a barrier between your mouth and someone's genitals or anus during oral sex. Again, dental dams can be a little bit harder to find, but most pharmacies and sexual health clinics will be able to point you in the right direction. If you don't have a dental dam, but you do have a condom, you can cut the end off and cut up the side and you will have a makeshift dental dam. Like all barrier methods, dental dams should only be used once. You shouldn't turn them over and try and use the other side, and if you need to, then you should use lubricants. Most barrier methods are made of silicone, which means that they're not compatible with oil-based lubricants. This will deteriorate the material and mean that your barrier method is not as safe. Testing for STIs at university doesn't have to be difficult. You don't even have to see a healthcare professional. If you're getting a regular check, you can go to Free and Clear, who are a Lincolnshire-based home STI testing service. All you need to do is fill in the form online and they will send you a free chlamydia and gonorrhea home testing kit, which you can post off and get the results sent to you by text. If you do want to see a health professional with any of your concerns, you can go to LISH, who are the Lincolnshire Sexual Health Service, or you can go to the doctor's surgery. In-person STI testing will typically involve either a swab, blood sample or urine sample, and again you can get the results sent to you by phone or by text. Regular STI testing is really important for your sexual health. Ideally, you should get tested between every new partner, and if you're in a long-term relationship with one sexual partner, then you should both get tested at least once a year. If you need any more information on STI testing or anything sexual health, then you can go to the Lincolnshire Sexual Health Clinic or your local GP. You can also access university resources such as the Wellbeing Centre or contact the University of Lincoln Students' Union Sexual Health Lead on ULSU_sexual health on Instagram. Sexual health shouldn't be a taboo. While you're at university, it's really important to take care of your sexual health along with the rest of your wellbeing. So remember, get tested, have fun and stay safe.